and making sure I've got my protective equipment on, gloves, preferably a mask, and goggles. So I'm going to explain the procedure to the patient. So I'm just giving saline today, so patient, I'm just going to give you saline. It's for condition X, and the side effects of giving this is I could miss, it's going to hurt just a little bit. There's secondary infection from a needle injection. So I'm going to assemble my equipment. So I've got my syringe, I've got my needle, my drawing up needle, and my drug here. So I've explained it to the patient. Now I'm going to select an appropriate site to do the injection. Such appropriate sites would be the deltoid or the vastus lateralis. Today we're going to do it on a sponge, so that's kind of helpful. Next we're going to clean the puncture site, or the site that we're going to do the drug, and then we're not going to touch it after that. So we're going to expose the site, and then I'm going to clean the site. So we start off in the middle and then just work our way outwards. And we don't want to touch the site now because we've cleaned it. And we're going to select an appropriate size needle for the site that we're going to do. 25 gauge would be good. And then we're going to put our drawing up needle on. We're going to do a drug check. We're going to check that we're giving the right drug. So sodium chloride, 0.9% injection. And it's in date. Can you check that for me?
Sodium chloride, 0.9%. That's before May 2019.
Awesome. Right, so open this. Right, live sharps, guys, so you have to be aware. And then I'm going to draw up 3 mils. Draw up 3 mils. Using the one hand technique, put the cap back on. And then we're going to dispose of the needle, the drawing up needle, sorry. And then we're going to place on our upper needle. So I'm just going to warn the patient that I'm about to do this procedure. So, patient, I'm about to inject you. It's just going to feel like a little prick inside your leg. So, and then what I'm going to do is I'm going to use the Z-tack method to tension the skin, and so once I remove the needle and release the tension, the drug won't leak out. So everybody, live sharps, and then tension, and I'll just use sort of a darting motion, just sort of like that, and I'll hold the needle, aspirate it just to make sure there's no blood, so there's no blood, so I'm not in a vein or an artery, and I'll slowly inject it. Taking my time because we're introducing a lot of volume into a space that is not going to expand that well, so there will be a little bit of pain if you do it quite quickly. So nice and slowly. Then we pull out the needle. It's live sharps again. Use the one hand technique to put it on. Remove the needle. And then we're going to check for signs of electric reaction. We're also going to document the time, route that we use, which is IM in this case, and the drug dose.